Hi, welcome back to our nursing procedure tutorials. This time I'm going to demonstrate to you how to prepare medications, injectable medications, and how to give it to the patients through subcutaneous. Like any other procedures, we have to follow the protocols. First, we have to identify the patients correctly, and then explain the procedure to your patient that you are going to give injection and tell her how she can cooperate, and then wash your hands thoroughly and gather your equipments, and then you can go to your patient's room, provide privacy, and start with your procedure. I'm going to prepare medication to be given subcutaneously. And the most common medication that is given subcutaneously is insulin. So, we have to prepare our insulin, read the label, whether it is the insulin that you need, and the expiration date, and check the cloudiness of the medication, so it's still okay. And of course, we need insulin syringe. This is a 1 cc syringe with attached needle gauge 29, a very fine needle. You can use also any other 1 ml syringe in giving subcutaneous injection, as long as the needle that you're going to use is gauge 25 or even smaller than that. Of course, we need the alcohol swab and the band-aid that you will apply to the patient's site of injection after. Okay, after thorough hand washing, we prepare this medication and equipment. So, we have to remove the cover of the vial and then wipe the top of the vial. Open this syringe, insulin syringe, with the needle attached. This needle cannot be removed and cannot be replaced. So we can use this one as aspirating needle, and at the same time, we are going to use it as injecting needle. So, how much is the doctor's order? Let's say 20 units of insulin. So you will place it in the 20 unit calibration with the air to be injected inside this vial. Then remove the cover of the needle and then inject the 20 unit of air into the vial. Invert the vial and get the desired amount of medication, which is 20 units. This is somewhat a little bit viscous, so it takes a little time for us to aspirate the medication, plus the fact that the needle is very fine, it's gauge 29, so it takes a little time to get the medication. Okay, so it's now 20 unit. We'll see now it's in the 20 unit calibration, and then recap your needle using the scoop method. Okay, fix it well, and now we are ready to go to our patient's room. Okay, now I'm going to give subcutaneous injection to our patient. Of course, we have to wear disposable gloves or clean gloves as our protection. We have to identify our patient correctly, explain the procedure, and provide privacy. Sister, what is your name? She said, I'm Aisha. Okay, Aisha, can I check your identity bond? Okay, this is Aisha Marie. So she is the correct patient. Aisha, I'm going to give your medication through subcutaneous injection. And then she said, okay, thank you, sister. Okay, so to have a better look and a better demonstration, I'm going to do it to our arm simulator. Okay, so this will be our patient, wherein I'm going to inject the, let's say, insulin through subcutaneous. Okay, so in giving subcutaneous injection, we have different sides. We can give it to the lateral side of the arm of the patient. We can give it to the abdomen of the patient, right and left part of the abdomen of the patient. We can give it to the lateral side of the patient's thigh. So in a rotating manner, we can alternately give this injection to our patient if she is regularly receiving subcutaneous injection like insulin injection. So the same thing, we have to cleanse or prep the injection site. Okay, so the correct location of our injection site is the upper 2/3 of the lateral side of the arm, which we're going to do it here. Okay, so in a rotating manner and circular manner, cleanse or prep the area or injection site about 1 to 2 inches in diameter. Okay, get your insulin syringe with medication inside and in an angle of 45 degrees. If the patient muscle is just a moderate body build, you can do it 45 degrees angle. But if your patient is having a big body, then you can do it as 90 degrees angle. So here I'm going to show it to you in a 45 degrees angle. Okay, so slightly pinch the patient's arm and in a 45 degrees angle, so you can see here, inject the medication. Okay, slightly or gently aspirate it also and slowly give the medication to your patient. Okay, that is 45 degrees angle. Then remove it and gently rub or massage the patient's site of injection. You can also place the band-aid to the injection site. Okay, so that is how to give subcutaneous injection to our patient.